Angela, good morning. I'm so glad you're here with me for this conversation today.
Good morning, Dr. Kate. I really appreciate the opportunity.
Yes, I'm so excited. We're here to talk about Impact HealthShare, something I'm very passionate about. I think
Exactly.
that is a product that could really save entrepreneurs time, money, headache, and get quality healthcare coverage. But first, I want you to tell us a little bit about you and how you are an expert in this realm.
Well, thank you
Mhm.
again for having me today, Kate. I have been in insurance, in traditional insurance, for over 37 years. And so this was brought to me, Impact Health Share
Mhm.
was brought to me months ago, and I just fell in love with the whole concept.
Yes.
I love it that it's a faith-based organization.
Mhm.
I love it that everybody contributes to a larger pot of money, so to speak,
Mhm.
and claims are paid out of it. We're helping each other, supporting each other in our healthcare journey. And that's what that was the big appeal to me. Secondly, the appeal to uh, Impact is price. So I'm sure we'll get into all of that. But as an expert, I consider myself an expert in the insurance industry. I feel like it's been around for a long time, but it's really going to blow up because it's so smart.
Well, and right now people need to be smart with their money.
They do.
Very much so.
They do.
So you said you've been working in the insurance realm for 30 years?
Yeah, a little
Wow.
over 30 years.
So a lot of as I've gotten to know you and as I've gotten to be involved in Business Networking International, I've learned so much about insurance. So
Mhm.
can you tell me a little bit about what types of insurance and what you had to do to get certified to be able to be involved in this business?
I started when I was 20,
Mhm.
and the insurance industry has evolved and changed a million different ways.
Mhm.
There's a lot of certification, a lot of education that goes into. Uh, you can be barely certified, but I've taken it to a different realm.
Okay.
I am super certified at everything. I take classes. My CE credits I have enough credits for years to come, simply because I love the knowledge. I love seeing where the trends are going as far as marketing. What do we need to start looking at? What's going to be the hot topic, in 6 months or a year? So I not only am I trained professionally, I have on the job experience, but then I have an interest. I love insurance.
Wow.
I
Thank God I have you to help me out.
it is a little weird. I have a T-shirt which I should have worn today. It says "Insurance is my love language," and that is pretty true because it's fascinating to me.
Mhm.
It's like air. You have to have it.
Mhm.
You might as well have an expert, and that's what I've tried to make myself. But I understand it from the business owner perspective as well,
Mhm.
and budgeting, and it is a major line item in most people's budget,
Mhm. Mhm.
personally and professionally. So, and I have access to probably 100 different carriers that I can look at for your just. I can insure an event, a wedding, all the way up to manufacturing, wholesaling, all of that, and healthcare. And because of you and other people that I've come in contact with recently, I've taken a deep dive into that. And then as business owners, that's where Impact has really filled that need
Right.
for business owners.
So you've done all types of insurance
I
from
have.
liability, car, health insurance.
Mhm.
What am I missing?
Life insurance.
Oh.
Yeah, that's I really enjoy life insurance because it can be
Mm.
something you can benefit from as you live and then after you die.
Yeah.
And so we put together some interesting packages where in endorsements that can make it a living benefit as well as a life insurance benefit.
Yeah.
And that's not that common in the industry.
Right.
Mhm.
I recently took a deep dive into organizing my life insurance, and
Mhm.
Angela is, disclaimer, she is my insurance provider, and I'm
Mhm.
grateful for that because you've helped me get reorganized. You helped me evaluate what I have, what I had, what we need to change, what I can keep the
Mhm.
same, and I know that you really have been helpful to what's best for me. Even sometimes you've recommended, oh, keep that policy you already had
Mhm.
because you got good coverage. Just
Yeah.
keep it. So what I appreciate is you're looking out for me.
I am. That's what I've been put on this earth to do, to
Yeah.
help people. And it just so happens I landed in the insurance industry.
Yeah.
And I take pride in my customers' referrals, tons of referrals,
Mm-hmm.
and that shows me that I'm doing a good job.
That's
And
right.
that's all I want to do.
That's right.
I'm at a point in my life, I'm not starving. I don't have to sell you a policy to have lunch, or whatever. I can look at the big picture and generational issues, or not issues, but generational opportunities
Yes.
for children or the next generation to be prepared.
That's right. That's right. Well, so let's dive into Impact HealthShare. And
Okay.
actually, the story was I actually attended a Business Networking International, a BNI event where
Yes.
I learned about Impact HealthShare. And the first thing I did was come to you.
You did.
Angela, have you heard of this? Is this legit? What is this? And,
Mm-hmm.
that started the conversation.
Mm-hmm.
And so for those who are listening who maybe don't know the difference between health insurance and health sharing, can you, the expert, try to help shed some light to that subject?
Absolutely. Traditional insurance is highly regulated. It has, and it's in place to make money.
Mm-hmm.
It's a for-profit business.
Mm-hmm.
Impact HealthShare. I can't speak to any other HealthShare. I just want to just have that disclaimer.
Sure.
I've not looked at other companies because Impact was so amazing, transparent, and helpful. HealthShare is where we have members.
Mm-hmm.
We take money, premiums.
Mm-hmm.
So it looks like insurance, which is helpful.
Yep.
Because that's what we're used to. So we take those premiums, put them in investments, and there's a board that controls that, kind of like traditional insurance, but the money all goes back to paying claims.
Yeah.
With this health share, they really promote wellness.
Mm-hmm.
So you have an opportunity to be reimbursed for a gym membership, for healthy food, healthy supplements, that you can submit and get paid for up to a certain amount. Massage.
Yes.
Oh, yes, exactly.
Massage, chiropractic, supplements.
Right. Yeah. I mean, it's just amazing. And so with that little benefit, sometimes will really, really knock down your premium. You're out, but you pay out. It doesn't, so you still pay your premium, but you get reimbursed. So it kind of levels that out a bit because you're going to do that anyway.
I am. And I want people to do that anyway.
And they have the freedom to do it now.
Yes.
It's a direct benefit to them financially. I mean, you have to have health insurance to survive in this world.
Yes.
And then we also have the component of Medicare supplement.
So yeah, tell me about that. You've been learning a lot about that. I'm not near the Medicare age for myself yet, but this is something that maybe if my parents wanted to use it. So I want to hear a little bit more about this Medicare supplement through Impact Health Sharing.
Yeah, so you do have to have Medicare A and B, parts A and B to qualify, but it pays for the deductibles. It pays for things that may fall through the cracks with A and B. It's not a supplement, so to speak. It's not Medicare Advantage and it's not Medigap. It's HealthShare. You submit your additional expenses that maybe A and B doesn't cover, and I won't go into that because it's
too cumbersome.
50-page, 10-font explanation of that. Plus, yeah.
And thank God you know that stuff because I won't.
I know that stuff.
Yes.
And, quite honestly, the company I work for offers that as well. So it just opens up opportunities to see where you want to go. What do you want to do? And I love choices. I do not like a box. I never have lived in a box. Yeah. I've lived in a strangely odd shaped life. I mean,
a blob.
A blob.
It changes.
It changes.
And grows with you.
I love that, being able to do different things and provide, because again, I love to take care of people. And it's like, okay, this and this and this, and then just take a peek at this too. Let's put it all on the table. You figure out, and with my assistance, what you need. Yeah. And so I love it. It's a challenge every day, and everybody's situation is different. Yeah. But it seems like the health share component is flexible to a point that unless you're in a group plan, you might want to look at this. Yeah. And I recently gave a quote that cut a family of four's health insurance expense in half, literally in half. Yeah. That makes a difference.
Yes, it does.
It does. I mean, it may make, you can go on a vacation or you can save money. You can put a kid in college with $400 to $500 a month
Oh yeah.
savings.
So when I signed
So
up for
yeah, hmm
when I
right,
signed up for Impact, it
yes,
saved me $400 a month. I'm an individual. It saved me
hmm
$400 a month when I needed it, because it was like I needed to get my kid into a new school. We got him into a private school this year, and that $400 a month savings in my health insurance made
hmm
it seamless. All of a sudden, it didn't feel like another major expense. So it
exactly.
was very helpful to me.
Exactly. Well,
Hmm.
and people should just look into it.
Yeah.
Now, it another beautiful thing about the Impact is that you can have it as a group plan as well.
Hmm.
Uh,
Meaning, as a group plan, you mean like an employer could have
an
a group?
employer can
Hmm.
have it. It looks like a group plan. The beautiful thing about it is it can be payroll deducted, which is a savings
Hmm.
there.
Hmm.
And if you leave that job, you can take it with you.
It's portable.
It's portable.
Wow.
So your deductible, annual deductible, I mean, and we have big choices of deductibles,
Hmm.
and things can help offset that cost as well. You can have a family deductible.
Hmm.
That is just not common in general healthcare. And then individually, if you go out and shop for healthcare like you would have had to do, you don't have an employer. It would
Hmm.
have been independently.
Hmm.
It's amazingly expensive.
Yeah.
And
Yep.
this is, it's just, but it looks like insurance. You feel like it's insurance,
Hmm.
and it is, but it isn't.
Yeah. We're going to talk about that more in just a second, but I just want to share a little bit of my testimony
Oh,
as an
sure.
entrepreneur, as not just an entrepreneur myself. 5 years ago, I started a private practice. This is where I needed to be able to find insurance.
Hmm.
I was paying $600-700 a month for something that barely, one of my policies didn't even cover my mammogram,
Oh,
which really upset me.
yeah.
So when I found Impact, I was like, this is it.
Hmm.
Now I have also started two other businesses trying to encourage more entrepreneurs in the health and wellness realm and the
Exactly.
healthcare realm. And to me, this was a big piece of that puzzle of,
Hmm.
okay, people that work in healthcare are used to having their health insurance from their employer. We got to figure out a way to solve that, because that's a barrier to a lot of people
It
going into private practice.
it is. It is. And to that point, uh, if you have employees, you can easily offer that as a benefit,
Hmm. Hmm.
and it will attract employees if you offer
Absolutely.
that. But it's just so important to have a plan.
It's important to have a plan. It's
Now,
important.
as an entrepreneur, you have to have a general liability
Hmm.
policy. You have to have in your business a
Hmm.
malpractice policy,
Hmm.
and then what are you going to do for your health care and life insurance?
Yeah.
So it just becomes more important. And then another thing with life insurance, I mean, we could go on and on and on about this,
Yeah.
but with life insurance, who's going to take over your business? Are you going
Hmm.
to be able to sell it? You have to
Hmm.
have key person
Yeah.
insurance, and you can benefit your family or you can benefit a partner.
Yeah.
So just look at the big pictures. I really promote that outside of impact, but to include impact as well.
And I just want to reassure everybody listening right now that Angela's contact information is going to be included with the
Oh,
notes of
good.
this show in case they need someone like you to help them with
Yeah.
all of this. I want to go back to something that you mentioned, and I did want to talk about this with you. So, Impact HealthShare is a nonprofit organization, and the way they get that categorization is being a faith-based organization. And
Yes.
now, I just want to disclaim I am a believer and I am a Christian, but I don't love having religion and government and healthcare intertwined. But
Hmm.
that's how it is, and that is.
You're so right. Exactly. That's so correct. And there is no question on the application.
Mhm,
What faith are you?
mhm.
Are
No,
you?
they don't ask for that.
And but the fact that it is, and it's to benefit the members.
Yep, they are a faith-based
Hmm.
organization, but they don't put it on
There's
their
yeah.
members.
Hmm.
Now, I have neighbors who have a health share. I can't remember. I wouldn't want to say it, that they have a health share through a different organization. And when they
Hmm.
were telling me about their process, when they call in and have to ask a question, the first thing they do is pray. Now, in uh, in the right setting, I'm fine with that.
Hmm.
But I don't love that with my health care. So I am really grateful that Impact is a nonprofit faith-based organization, but they are not projecting that desire onto their customers.
Exactly. No,
Hmm.
and it's just to me an added benefit if you want to accept that or not.
Hmm.
That's up to you.
Yep.
But the bottom line, you need insurance.
Hmm.
This is a great opportunity.
Hmm.
And so if we could take it just a little further as well,
Mhm.
it's a business opportunity.
Yes.
There is just a test you have to take just
Mhm.
to make you familiar with the concept, and it's not licensing
Mhm.
because it's not regulated by the government.
Mhm.
I mean, and strictly regulated.
And some people hear that and they're out the window. They don't want to know
Mm-hmm.
anything about it, and that's
Mm-hmm.
fine. I kind of like that this isn't regulated by the government because I have some issues with some of the things that have come from that program.
Mm-hmm.
So to me, I think that's a benefit.
I look at it as a benefit because I'm deeply entrenched in the regulation part of
Hmm. Hmm.
insurance. I
Hmm.
have to be compliant. There are words I can't say. There are, and a lot of training goes into compliance and that sort of thing.
Yeah.
I I did a deep dive into the financials, the financial stability. It's rated more than it's on the top tier
Hmm.
of financial stability.
Hmm.
So we know that it's going to be around for a while.
Yeah.
It's been around for a while. It's here now, and they have a plan for the future.
When I watched the video, when I was
Mm-hmm.
learning about it, the numbers were very compelling. I
Yes.
and I don't want to be quoted, but I just want to say, they were talking about why health insurance is so expensive. And
Mm-hmm.
part of the reason health insurance is so expensive is because we have to cover all of the expenses. And I think the number that I heard was like 5% of the population uses over 50% of the dollars. So
Yes.
the top 5% really sick people in our country are using more than half of the monies that are premiums that we are all
Mm-hmm.
paying to our health insurance. So the caveat to a health share is that if you have pre-existing conditions, it may not be the best option for
It
you.
may not be the best option, but so I have one client that's interested. He has a blood disorder,
Mm-hmm.
and he's out of pocket a lot of money every month in addition to what his insurance covers. Okay,
Mm-hmm.
this could be a secondary follow-up. It could
Ah.
be insurance for his wife and children.
Mm-hmm.
He would be on it as well, and it would pay for some of those things that insurance doesn't pay for.
Oh,
So it
interesting.
can be a secondary. So his wife and kids are covered just like a like normal.
Mm-hmm.
I hate that word normal, but
Sure.
typical,
Typical
typical,
coverage.
typical coverage. He doesn't necessarily qualify for all the coverages, but he does qualify for some, and it depends on the disorder, or So I can't say that everything is going to work out like
Mm-hmm.
that, but it's worth looking into.
Well, so it sounds like he has his primary insurance, and this is a secondary
It's a
policy for
secondary,
him.
hmm
That's
but
interesting.
it's primary for his family.
Family.
Yeah.
Oh, that's interesting because I was
Hmm.
having a situation in my family where I was thinking, oh, my children and I maybe could be on this policy, but my partner doesn't. It may not make sense for him, but it could be his secondary
Could be a
policy.
secondary policy.
Ooh, I just learned some ways to save some money, Miss
Yeah.
Angela. Thank
Yes.
you.
Yes.
So let me see. So the numbers were very compelling, and I can't remember how long it's been around, but that also reassured me as I was
Hmm.
learning about this because
Yeah.
when I learned about it, it seemed almost too good to be true.
Exactly.
Hmm.
It well, it was, and then so you had other people look into
Hmm.
the contract,
Hmm. Hmm.
what they cover, what they don't cover.
Hmm.
You have to be covered before a pregnancy's covered, but a
Hmm.
pregnancy's covered after
After I think it was a
is a
year.
year.
I
Yeah.
think they just changed that from a year to 9 months. Or I
Oh,
don't know. Or I think they might have
it
changed it
has
up. Don't
changed,
quote
but
me on that.
yeah, but
Yeah.
if you're pregnant already, that is not going to be covered. Let's just put it that way.
Right.
Yeah.
Right.
Okay. So there are ways to save money. There are ways to help improve your health.
Hmm.
They promote well care, wellness checks,
Yeah.
all those types of things.
Hmm.
And as a business owner,
Hmm.
again, you can payroll deduct, but it's also if you can become a business owner with Impact.
Yes. Oh, yeah. I am now distributing.
You are,
I'm a
you're my
distributor.
upline.
That's right.
So and I love that.
Because I'm passionate about it. I want to share this with people,
Um,
and because I'm passionate about it and in this position, I can help other people, but it's going to help me too.
yeah, yeah, and you if as a business, if you have it as a business, I just want to go
Hmm.
there a little bit. Uh, of course, it's been proven, it's stable. We
Hmm.
know all that, but you can make it as big as you would want
Hmm.
to. We
Hmm.
have one lady who's under me
Hmm.
that is just going gangbusters with it because
Yes.
she's a believer. She has it for her.
Yeah.
She's a believer in the product.
So Angela, I can tell you're so passionate about this product. Can you dive into why you are so passionate about this particular product?
Well, from a business owner's perspective, and I am a owner of Impact,
Mm-hmm.
that's my business.
Mm-hmm.
I see opportunity to provide a sustainable product to somebody who they're going to benefit from it.
Mm-hmm.
You have to have insurance.
Mm-hmm.
You may not have to have, say, makeup or certain supplements and things like that. So, in addition to you selling that, if that's your business,
Mm-hmm.
why not expose your customers to something that will benefit them throughout the rest of their life?
Yes, because if you sell something like makeup or Tupperware, not every person you talk to is going to be interested
Exactly.
in that product. But if you also have this in your back pocket,
Hmm.
everybody needs to consider it. In my opinion, consider
At
it.
least consider it.
Yes.
Exactly. And it broadens your future. Plus, you make some pretty decent money.
Yeah. Yeah.
I mean, because you don't have 10 layers of people that take out of the profit.
Mm-hmm. Mm-hmm.
You have maybe a layer or two
Mm-hmm.
that the service side of it, but so it could be very, very profitable for you.
Yeah.
And it's in your everyday life. It could be part of everyday language. What are you doing with your healthcare? How are you doing with your healthcare?
Yes.
And it sells itself once somebody really looks at it. It
Yes.
basically sells itself.
Yes. So I would like to talk about something because, I've been in healthcare for over 20 years.
Exactly.
I've been working in healthcare. I have worked in different settings: outpatient, inpatient, and inpatient means the hospital, nursing homes, home health care, and now
Okay.
private practice.
Mm-hmm.
And let me tell you, my experiences tell me that the average person doesn't really understand health insurance. And so when we talked to our upline, Monty, he
Mm-hmm.
said that people want to know, does this work? And how much does it cost me?
Mm-hmm.
And that is it. And I think that's a problem with the for-profit health insurance industry now is people think, oh, I have insurance. Well, do you really?
Do you really?
Is it
And
catastrophic? Is it going to do, cover your screenings that are necessary at a certain point?
prescriptions?
Right.
Mm-hmm.
So what I did to make sure that I was comfortable with Impact was I read the guidelines. Now, it's not a 50-page, 10-point
No,
font
it
like
isn't.
your Medicare,
Yeah.
but it was a little cumbersome. I mean, I think I read through it. I think it probably took me 20 minutes or
Mm-hmm.
so
Yeah.
to read through it. And I think that's a piece that people often ignore. So when I read through the guidelines, I shared them with my now ex-husband because I said, hey, I'm really interested in getting the kids on this policy
Mm-hmm.
here. And he had some concerns with the wording. And I had to say, go look at your own health insurance and compare the wording.
Mm-hmm.
And all of a sudden he went, oh, well, it's the same.
It's kind of cut and dry. It either is or it isn't.
Yep.
And the gray areas are easily explained by Monty because he's an expert, and we have total access to him.
Yes, he's wonderful.
He even called me back on the day that his wife was in surgery while he was waiting. I mean, it's just easy for him.
Yeah.
The other point, and you as a policyholder, as a HealthShare participant.
There we go. Right.
I'm so sorry.
That's okay. I love it.
The
devil is in the details, and this is not insurance and it's not a policy, but it feels so much like
it. But that's because it's what we're used to, and we like to hear that.
Mm-hmm.
Providers, have you had a problem? That's the main question I get. Have you had any issues having the people that you go to, your doctors, your providers? Are they part of the group?
I want to talk to you about this because I will say I get a little nervous. Like when I go in for a new appointment, like, oh, am I going to have to explain this to them?
Mm-hmm.
Well, I do a little bit of explaining and they take it and they take the information and then that's it.
Mm-hmm.
I will tell you, I was a little irritated, and I'm irritated with the provider, not Impact, because they said, oh, that's not health insurance. We will not bill it. And I said, okay, well, but it functions like health insurance. All you got to do is send them the exact same information you would as if it was health insurance. Well, it's not health insurance. We're not going to do it. So guess what? I'm not going to go back to that provider.
Right.
What I had to do, and Impact did cover that. It was for my regular screening mammogram. I did have to talk to Impact and get the information. They gave me the exact you need to ask for this document or that document or this document, depending on their language. These are the 3 documents, the names of documents that you need to ask them for. I went back to the provider. They emailed me those documents. I uploaded it to my portal at Impact HealthShare, and I think it was just a couple days ago, got the notification from Impact that those bills were taken care of.
And that, and again, it's so seamless because we don't have all of the holes,
Mm-hmm.
and things to jump through.
Right.
We just it's seamless, and that's what I love about it.
It's seamless, and the communication is direct and easy.
Mm-hmm.
So I used to have a policy. Am I going to get in trouble if I tell you who who the policy was if I'm talking trash on the experience? I don't know. I'll just
Maybe.
keep their name out, but it's a major health insurance company that I had for a while. And when I was trying to upload documents and get them information, and then it was like they always were asking for more information, and I had to say, I literally told them, the information you told me that you need is on the document I sent you. Please do your job and process this claim.
Mm-hmm.
Because I think that health insurance company, I think their first step is to say, oh, we don't have enough information. And then people throw up their hands and get frustrated and then just pay the bill themselves.
Exactly, and don't ask for reimbursement. The trend in insurance and insurance in general, let's just put it this way, I'm not going to say health share because it is not included in this statement,
Mm-hmm.
is AI.
Mm-hmm.
Keywords, if they're not there or if they're there too much, you're automatically declined. And I think in homeowners insurance, because I'm exposed to that on a
Mm-hmm.
daily
Mm-hmm.
basis, most companies you can't even talk to an underwriter and say, well, somebody just made an inquiry, but it shows up as a claim. AI looks at it as a claim, and we're going to non-renew you or whatnot. That is not true with Impact HealthShare. I cannot speak again. I cannot speak about any other health share.
Right. We are experts we aren't experts. We are very familiar with Impact
We're
HealthShare.
Participants.
Yes.
And our feelings and our needs are heard.
Mm-hmm.
That's the other thing.
Yes.
With the larger companies that are going more toward AI, you're not heard. Right. I mean, and it's becoming like a joke.
Well, and I think I got the email, and I didn't take a deep dive into it, from Impact saying, oh, and just today we've added chiropractors can provide peptides, and that will be covered. I mean, so all the red tape and all the things that other insurance companies won't, it takes years for them to alter their policy. Mm-hmm. Impact went, oh, there's value in this. We should cover this. We're going to cover it.
Right. So full disclosure, I have TRICARE for life because of my late husband. Yep. That was a benefit provided to me. Mm-hmm. But they will pay for chiropractic care, but they won't pay for peptides or cold laser or different things that could possibly be covered through HealthShare.
And very beneficial to
the person. It's really the only, and for me personally, I have a neck issue. Nothing else works except cold laser, and it's actually curing it. It's not just treating it.
But have you tried myofascial release?
I have. Well, that is another.
Sorry, I had to just throw a shameless advertisement into the conversation.
And I think you should. And what do you do for, people probably are familiar with what you do through your podcast.
A lot of people don't know what myofascial release is, and that's okay. That's for a different episode.
And I think that's so important. Mm-hmm. And because, and that's another thing, we as business owners that own an impact opportunity, we can talk about those things, and we can refer people to people we know that are familiar with it. And so we're building our network as well. And we would love for any of our listeners to join in and at least explore the opportunity as a business. But then if you're not interested in that at all, please do yourself and your family a favor by exploring it.
Read through the policies, and maybe I'm going to invite you. I don't want to say challenge, because challenge sounds like no fun. But I invite you to compare the guidelines from Impact to the policies of your current health insurance, and I think it'll be eye-opening because they're going to be similar, depending on your policy, whether you have catastrophic, where you only get covered if you're sick or hurt, versus covering well visits, etc. I think it'll be eye-opening to see the difference. And I also really, from my perspective of being in healthcare this long, I would love for people to really explore their insurance, because insurance alone has benefits, but they don't make it easy. They don't make it accessible. Something that I had to do when I signed up with Impact, I had to set aside time to learn how to use it properly. Okay.
True.
And
Yeah.
that's how we should be with anything, like, my technology for the podcast. When I get, I have new
Mm-hmm.
microphones upstairs that I haven't read through and set up yet because it takes time to learn how to use a new product.
It does.
People need to look at their insurance as a product that they
Mm-hmm.
need to learn how to maximize and how to use and how it can benefit them. So
Exactly.
I did take some time with Impact, and one of the differences, there's many differences, but I had to say, okay, when I want to get my labs, what's the process? Well, I
Mm-hmm.
have to log into Impact first and purchase my labs, and then take that to the lab, and then they do the service. So it's just a slightly different process. The first time was a little bit frustrating just because it was different. Oh, well,
Mm-hmm.
now I know. And guess what? I am paying, I think the amount I paid for those labs is very comparable to what I was paying with my prior insurance,
Okay.
but my premium is less than half of what I was paying
Exactly.
for my insurance.
Exactly. So yeah, it might be the same as another insurance policy
Mhm.
or an insurance policy, a different one, but look at your bottom line.
Mhm.
And
Mhm.
and that's one of the things that I do as a whole on personal insurance or health insurance, whatever. What's your outgo and what is your benefit?
Yes.
And don't look at everything individually. Look at the average and the balance of what it is. And I think that's such a good point,
Mhm.
because yeah, and the nice thing about it is too, if you don't need to use your insurance on a regular basis or your
Mhm.
coverage. Let's
Mhm.
let's just start calling it coverage.
Coverage.
If you don't need your coverage on a
Mhm.
regular basis, your premium's low. You're not paying a high premium for never going.
Right.
They encourage you to go to the doctor,
Mhm.
but if you don't use it and you want to just set it aside for a major issue that might come up on something unknown, you're still not paying an exorbitant premium
Right.
and getting no benefit.
Exactly.
Hmm.
Exactly. So, my business Thrive Everywhere, which will be hopefully launching sometime soon, a part of that online platform is an educational piece because I want people
Hmm.
to learn what insurance means. And to the average person, sometimes just the different words of premium, deductible,
Copay.
copay.
Hmm.
What does that mean? Well, on our platform, when we go live, there's going to be a whole section that makes it very
Hmm.
easy to read and understand the differences, whether that helps encourage someone to look at Impact or not. What I want is for people to better understand their health insurance,
Exactly.
because when you don't understand it and you get sick, it can lead to exorbitant bills, because you go and you do what your doctor tells you to do, but your doctor doesn't know your insurance.
Right.
They know
That's not their
medicine. That's
piece,
right. They know medicine. And if they refer you someplace, oh, I'm going where my doctor sent me. Oh, but that's out of network. And your out of network deductible is different than your in network deductible versus, it can
Just
snowball so fast.
right. And I've seen financial ruin
Hmm.
over
Yes.
over
Medical
tragic,
bills.
medical issues.
Hmm.
It shouldn't be that way.
It
It
should not be
should be
that
there
way.
should be some peace and comfort.
Hmm.
The bottom line is with insurance, health share, what you're buying is peace of mind.
Yes.
When you come in my office, you may walk out with some documents, but you're not walking out with a bag full of whatever.
Hmm.
You're walking out with peace of mind, knowing
Yes.
that if in the event something catastrophic happens, or even just the day-to-day average bills are handled.
Yes.
You don't, everybody, most people can handle this. Most people can't handle this, with
Hmm.
their bills, just that's why I pay for a car warranty. I'm
Hmm.
happy to pay that so I don't have to worry.
Yes.
And so it's the same concept with insurance, whatever insurance you have, but
Hmm.
especially with your health, because those are the big numbers. They can be big numbers.
And there's so many unknowns.
There's so many
Not a
unknowns.
single one of us is a mind reader or future teller or whatever. Now, some
Uh,
people might think they have those gifts, and that's fine, but I need to have my own peace of mind.
Peace of mind, yeah, yeah, and with Impact, from a business perspective, none of my uh, participants,
Hmm.
members,
Hmm.
have ever complained about the process.
Hmm. Hmm.
No one's ever complained about the process.
I with the ADHD,
Uh-huh.
I
Well,
get real aggravated when I have to do things that are new to me or that I don't understand. And I've had to do that a couple times, but then
hmm
once I get it done, oh, why did I stress about that? Why did I put that off for a week or two? I
hmm
should have done this sooner. This was not as hard as I thought it was going
hmm
to be.
exactly. And the company itself
Hmm.
is so helpful.
Yes.
You go directly to live people
Yes.
to ask a question, or like how do I get my provider to bill you? And it's just so easy to communicate. And if you have a problem, you always have the person who signed you up,
Mhm.
but that's not your go-to. The company is your go-to,
Yes.
and that's comforting to me.
The person who signed you up, if you have an upline, if you have a business, that's one thing.
Hmm.
But if you have medical concerns, you go to Impact.
Right, exactly,
And I mean,
exactly.
if any of my participants have questions, I invite them to ask me. But there's a good chance I'm going to say you just need to call Impact, and
Right,
they're going to take care of you.
exactly.
But
Now we
also let me know what the resolution is so I can learn from this.
or yeah, or do a conference call, say,
Yes.
and they're just so easy to work with
Hmm.
as a member who's using their services, or as from the business perspective.
Yes.
And I just can't say enough of good things about it. I mean, it's something that I'm so sold on it, and I
Hmm.
believe so much in
Hmm.
it. I'm going to leave the other behind eventually,
Hmm.
once I can build my group of members that,
Hmm.
I can sustain. I can have it as an income, a
Yes.
legitimate income.
Yes.
And that's all I'm going to do. That's
Yeah.
all I'm going to do. And because I believe in it. And not that I don't believe in insurance companies, because they are there, but just make sure you have a good agent that can advocate for you.
Yeah. Listen, healthcare coverage
Uh-huh.
is necessary. I believe health insurance has become a necessary evil, and I'm trying to get
It
away
is.
from that evil.
Hmm.
And I've done a deep dive, and I really think that when insurance was allowed to go to be a for-profit company, I think that's back in the 80s in the Reagan area, and I just think we're now seeing that trickle down
It is.
effect.
I mean, there is in every state in the United States, there is an insurance commission.
Hmm.
There's not always a commission for every little thing.
Hmm.
So, every part as part of our life, but there's an insurance commission that regulates,
Hmm.
and there's some good and bad. They can
Hmm.
put a cap on how high rates can go up, and they monitor that, but they've got to be paid too.
Hmm. Yeah.
So your tax dollars are going for something that's really becoming out of control
Yeah.
and too convoluted and messy to really be effective.
Yeah.
I believe in Impact HealthShare
Hmm.
because it's it's seamless.
Yeah. And when I learned about it, I said, okay, Impact HealthShare needs to be a part of my business
Hmm.
um, thrive everywhere, because this is, again, taking away a barrier from entrepreneurs going into healthcare, which is what I want. Because
Hmm.
the more clinicians we get going into private practice, the more we get to take over the control of our lives. I was in healthcare for almost 20 years and just spinning my wheels, not actually taking care of people, but trying to do what was required of me by my manager and by the insurance companies. And man, it's exhausting. And quite frankly, they didn't pay me enough for that.
Hmm.
So I had to take the leap, and not everybody can, and I understand why.
But more and more people are.
Yeah, and I want to take away the barriers,
Yeah.
because we can take control of our lives, we can make
Hmm.
more money, we can make what we are worth, and we can shine a spotlight on private practice compared to corporate healthcare. There are
Exactly.
wonderful clinicians in corporate healthcare, don't get me wrong, but they are not given the business model to care for people the way we were taught to care for people.
Right. And oh, I love that. And
Mm.
I seek out more private
Yes.
practice, uh, providers because of that.
Yes.
I'm not I'm not depending on someone sitting in an office who just knows the script, no imagination, no saying, oh yeah, this could help them,
Mhm.
so we're going to approve this and
Mhm.
move forward with someone's health. So it takes that out as well.
Yeah. Yeah.
And I applaud you for taking that leap. It was a big
Mhm.
leap.
Yeah.
My daughter just took the leap as
Yes.
well,
Yeah.
and it's a passion that you have, and
Yeah.
I love that.
Yes.
I love that you had the courage to
Mm.
step away from that and do what you know to do as
Thank
the
you.
best care.
Thank you. I had some support along the way that made it possible.
Well,
So I
yeah,
just have to.
and
Mhm.
you're lending support to other people
Right,
that
because
want to do it, men and women.
yes, because listen, that support is how I did it. Knowing that I had a partner who had my back, and you know, it if for people, as a single mom, there was times when I didn't have a partner, so I know
Hmm.
very well what it's like to have a single income. But I think the people, as a single mom, I'm a woman, so I know what it's like to be a
Mhm.
single mom, but single dads too, they are
Absolutely.
stressed out too. Being able to have the energy at the end of my day to pour back into my family, which is
Mhm.
what I have now that I am in control of my practice and my hours and my job. Man,
And the frustration level is
mhm,
probably at least waning, if not gone,
yeah.
because you are doing what you're trained and what your passion is
There are still
to help people.
frustrations, don't get me wrong, but it's not
Mhm.
every single moment of every single day. It's here and
Exactly.
there,
Like I said, it may be waning, it may not
Yes.
have gone away,
Yep.
but at least you can control it a little bit better. And
Yeah, it's easier to roll with the punches when you're the boss.
mhm,
When
exactly.
you're your own boss.
Mhm.
And yes, that comes with some weight, but it to me, the pros outweigh the cons. It really
Oh, I
does.
love that
And
for
in part
you.
because I have people supporting me like my insurance provider, Angela
Mhm.
Howard. Thank you
Thank
so
you. You're
much.
welcome. You're welcome. And
Because knowing
I
that
have your best interest at heart.
I know you do.
And so please find someone, if you don't use me, please
Mhm.
find someone that will do that for you as
And
well.
you are licensed to help people in which states?
Missouri, Illinois, Arkansas, and Indiana.
Okay, so if you're in Missouri, Illinois, Arkansas, or Indiana, my friend Angela can help you, and she has
Hmm.
helped me have so much peace of mind. So we will put in the notes of this conversation all the contact information for both of us and
Hmm.
information about Impact and about all the businesses that we are building to try to help change healthcare.
Yeah, it's a revolution. We're part of the revolution. Yeah, I love that.
Cheers to
Cheers.
the revolution. Angela, thank you for being here
Well,
today.
thank you, Dr. Kate, for having
I'm
me.
so excited to share this conversation with our listeners
Yeah.
so that they can learn about this and maybe
Yeah.
consider taking more control over their healthcare.
Oh, I love that. Okay, thank you again.
Yeah, glad you were here.